Good evening and welcome to another edition of the Yuba Sutter Medical Explorer. My name is Dr. Robert Peppercorn and my specialties are allergy and dermatology. I serve as host of this program. The purpose of the Medical Explorer is to explore the medical communities of Yuba and Sutter counties and to take you behind the scenes of medical care practices right here in our local area. We bring you a fascinating program tonight and another first for local origination programming in this area. In a few moments, our Medical Explorer Channel 5 cameras will take us behind the private doors of Dr. Nelson Copley's alternative birth room in Yuba City, where we will actually witness a natural childbirth. This will be a delightful half hour as we share the joy and happiness of parents. Before getting to our topic tonight, let's take a look at the latest medical news. There's mounting evidence that women who take estrogen at menopause and after cut their risk of heart attacks by about half, a panel of medical researchers recently announced. Some 13 recent studies reviewed at the American College of Surgeons annual meeting in San Francisco pointed to the cardiovascular benefit. Studies also show that estrogen decreases the risk of a brittle bone syndrome called osteoporosis, a major cause of pain, disability, and even death due to hip fracture complications in women aged 50 to 75. Doctors emphasize that estrogen should not be taken by patients at high risk for breast cancer due to either family history, a first pregnancy after age 35, prolonged infertility problems, or delayed menopause. Research suggests estrogen given alone can stimulate breast cancer in those women. Doctors increasingly are giving estrogen in combination with progestin, an artificial hormone, and the combined product appears to block endometrial or uterus cancer, which attacks the lining of the uterus. A 9-year study of several thousand women showed that adding progestin almost totally wiped out the endometrial problem. My next medical news story concerns cancer of the colon or large intestine. Men with sedentary jobs are 60% more likely to get colon cancer than those who have work that requires more physical activity. The University of Southern California study is the first to link the disease to a lack of physical activity. Colon cancer, which kills 60,000 people annually, has been linked to a low-fiber, high-fat diet. The study showed workers in sedentary jobs, such as bookkeepers, bus drivers, and computer programmers, had 6% more colon cancer than men in high-activity occupations, such as auto mechanics, plumbers, and longshoremen. Men in moderate activity occupations, such as salesmen and machinists, had a 20% higher risk. The theory is that physical activity stimulates the movement of waste through the colon, thus reducing the amount of time that carcinogens are in contact with the lining of the large intestine. My final medical news story concerns a new pregnancy test. An inexpensive, accurate, and simple test that detects pregnancy as early as a week after conception has received approval from the Food and Drug Administration. Called Nimbus, the test kit requires no instruments, and results are available in 6 minutes. The test is 99.8% accurate and costs about $2 to administer. My health tip tonight concerns one of the most common skin disorders. This, of course, is acne. Acne affects approximately 3/4 of all adolescents. Long considered an inevitable disorder of the teenage period, today acne can be effectively controlled with proper medication. There are numerous misconceptions about the treatment of acne, many based on the premise that acne is caused by dirt, oily skin, and poor hygiene. Although washing the face gently with a mild soap and shampooing the hair regularly are important parts of personal cleanliness, neither will prevent or cure acne. The most inexpensive and useful product available, both over the counter and with a prescription, is benzoyl peroxide. Benzoyl peroxide has a profound antibacterial effect that prevents the development of new inflammatory lesions. Some brand names are Oxy 5 and Clearasil with benzoyl peroxide. Other over-the-counter products that are much less useful include salicylic acid cleaners, alcohol cleansers, medicated soaps, and special scrubs. Scrubs that contain abrasives often irritate the skin and can worsen the problem. More serious cases of acne require professional care like any other medical disease. A dermatologist is specially trained in the treatment of all skin disorders such as acne and can prescribe a wide variety of proven medications. Several new drugs have proven highly effective when administered under careful supervision of dermatologists. These effective drugs include antibiotics, Retin A, and the newest, most powerful, almost miracle acne drug called Accutane. Early treatment by your dermatologist can prevent permanent, deep scars and damage to your skin. Now, on with the Medical Explorer. During the past 2 decades, many prospective parents have been looking for an alternative to the usual method of hospital childbirth. Several years ago, a specialist in gynecology and obstetrics brought a new childbirth concept to the Yuba Sutter area. This is the concept of the alternative birth room. Let's visit with the director of this alternative birth room and watch him perform a natural childbirth. Our guest tonight is Dr. Nelson Copley.
What we have here that we don't have in the hospital is the ability to let the entire family in if the mother wishes, let them stay constantly. And one other thing we have, which is of utmost importance to the mothers who choose this, and that the baby does not leave mother. There are plans now to develop an alternative birth room in the Fremont Hospital sometime in the next few years. The reason this cannot be done immediately is lack of space. When a family of perhaps 5 or 6 people gather around mother at the time of her labor, this would fill an entire labor room in the Fremont Hospital, and that labor room may have to be shared with somebody else. There simply is not enough room. Many hospitals throughout the state have alternative birth rooms and have proven how practical they are. I know of one personally in the John Muir Hospital in Walnut Creek. Mother plans to deliver there. She delivers there. Her baby never leaves her side. The nursery people come to the room to do the testing and such things that baby needs. The pediatrician visits the baby there. The obstetrician visits the mother in the alternative birth room until she is ready to go home, and she is just from that place. The essential things for mother's safety are here. The essential things for mother's safety will be there. And what mother is looking for, no matter how she says it, what she's looking for, she wants to keep her baby. She doesn't want to go off somewhere else. And she wants some of her family with her without being subject to dismissal or being told to wait outside for a minute while we do whatever it is we do. Since 1977, I've been doing alternative birth deliveries. Some of them were done in the main office, and some in this special out here. Between 30 and 40 deliveries a year are done in the alternative birth room. An alternative birth room is important for this community because without it, there will be people delivering at home. Home births are dangerous. There's no question. They are dangerous for mothers, but even if mothers get by, bonding is that psychological arrangement between mothers that begins when the child is born and first looks into its mother's eyes. As a result of bonding, mothers become protective. Instead of being annoyed at this bundle of humanity they must care for, they become protective, and they will care for to the